Hello friends, let us now learn some important points about the peptic ulcer disease. So in the peptic ulcer disease, the drug of choice for peptic ulcer disease includes proton pump inhibitors are the drug of choice for peptic ulcer disease. So proton pump inhibitors. So if you see in the proton pump inhibitors, first and foremost, this is the cell. Okay, in the cell there is one H plus K plus ATPase. There is a H plus K plus ATPase which will secrete H plus ions and they will reabsorb the potassium ions. So there is also a nerve ending which will secrete acetylcholine on M1 receptors, and thus this will activate the H plus K plus ATPase. We have histamine which acts on H2 receptors, and even this histamine acting on H2 receptors will also activate the H plus K plus ATPase. Then if you see the drug the enzyme cholecystokinin, this will act on G cell receptor and this will activate H plus K plus ATPase. Whereas the hormone, the enzyme prostaglandin E2, the chemical prostaglandin E2 will inhibit H plus K plus ATPase. This prostaglandin E2 also causes vasodilatation and this will cause bicarbonate secretion, and also mucus secretion occurs in prostaglandin E2. Now, the NSAIDs will inhibit the cyclooxygenase enzyme and thus decreases prostaglandin E2 levels, and thus finally it increases HCl concentration, which leads to NSAID induced ulcer. The specific drug for NSAID induced ulcer is misoprostol. Misoprostol is a specific drug for NSAID induced ulcer. Drug of choice for NSAID induced ulcer is proton pump inhibitor is the drug of choice for NSAID induced ulcer. So now the first group of drugs which we have to learn here is muscarinic blockers, because the acetylcholine is activating M1 receptor which will in turn activate H plus K plus ATPase. So if we block this muscarinic receptor, then obviously the H plus K plus ATPase is blocked. So this M1 blocker include pyrenzepine and telenzepine. This pyrenzepine and telenzepine blocking M1 receptor is not available in India. Then we have H2 blockers. H2 blockers include cimetidine, ranitidine, famotidine, loxatidine and nizatidine. Cimetidine, ranitidine, famotidine, loxatidine and nizatidine. This famotidine is the most potent H2 blocker. This H2 blocker will block the H2 receptor. This is histamine receptor, histamine type 2 receptor. So this H2 blocker will block histamine type 2 receptor present on the parietal cell, and thus it will inhibit the gastric acid secretion. So this H2 blocker will also suppress the all phases of gastric secretion from basal, cephalic and also gastric secretions. Then this also, one more important thing is this H2 blockers also inhibit the nocturnal acid secretion, that is they inhibit the acid secretion at the night time. They will also decrease the acid secretion which is stimulated by acetylcholine, gastrin and foods. They will also decrease the pepsin secretion for shorter periods. They will decrease the pepsin secretion for shorter periods. So if you see the pharmacokinetics, they cause oral administration or IV administration. Here These drugs are well absorbed and metabolized in the liver, and they are secreted in the milk. They are well absorbed and metabolized in the liver, and they are secreted in the milk. So if we see the side effects of proton pump inhibitors, the main side effects include side effects of H2 blockers. First, H2 blockers. The side effects of H2 blockers mainly includes, we have headache, fatigue, myalgia. It also causes constipation. So next important H2 blocker is cimetidine. Cimetidine is not used because it will inhibit CYP enzyme, and this will also increase the concentration of warfarin and theophylline. This cimetidine is least potent H2 blocker. Side effects of cimetidine are, these can cross blood-brain barrier, and thus they can result in mental state changes. This cimetidine can also inhibit the binding of dihydrotestosterone to androgen receptors, and thus this cimetidine can manifest impotence in males. It can manifest impotence in males. This cimetidine also inhibits the metabolism of estradiol. It increases the prolactin levels, and thus in males it causes gynecomastia, and in females it causes galactorrhea. So these are the important points in cimetidine. Then if you see the next drug, which is nizatidine. Nizatidine has anti-acetylcholinesterase activity, which causes bradycardia, and also it causes increased gastric emptying. This nizatidine has negligible action on first pass metabolism. Nizatidine has negligible action on first pass metabolism. So these are the important points about H2 blockers. Thank you for watching. In the next class we will learn about proton pump inhibitors.